What is an artificial urinary sphincter, or AUS? An artificial urinary sphincter is a device made of silicone material that helps to treat urinary stress incontinence. An artificial sphincter has an inflatable cuff that fits around the urethra close to the point where it joins the bladder. Patients with severe or worsening urinary incontinence, or patients who are not candidates for the male sling operation, may consider an artificial urinary sphincter which replaces the lost function of the urinary sphincter. The overall satisfaction rate for patients who have the artificial urinary sphincter is over 90%. Procedure. The entire procedure takes about 1.5 hours. During the procedure, the surgeon will implant a small blood pressure cuff about the width of your finger around the urethra right where it joins the bladder. It inflates and collapses the urethra to prevent urine leakage. A small pump will be placed in your scrotum. This is the pump activator. By squeezing it, the fluid from the cuff will flow through the pump into a small reservoir that's usually implanted in the abdomen. This deflates the cuff. During this time, you will be able to urinate. Once you release the pump, the cuff will repressurize within 2 minutes, stopping the flow of urine. Risks and side effects. The most common complications from artificial urinary sphincter are infection, bleeding, cuff erosion into the urethra, and postoperative pain. You may experience some postoperative discomfort and mild bleeding. On rare occasions, there may be erosion of the cuff into the urethra or infection. In those cases, the implant would have to be removed and reimplanted at another time. Over time, there may also be urethral atrophy. Patients will find that leakage may return slowly. If that occurs, it may require additional operations to move the cuff to a healthier part of the urethra or to add an additional cuff. Patients must have a medical alert and tag to let their healthcare providers know if they have an artificial sphincter, since it will need to be deactivated if placement of a catheter in the bladder is necessary. Prepping for the surgery. Before the surgery, patients will be instructed to wash the surgical site with Hibiclens for 3 days. Several days before surgery, all blood thinners are stopped. Please ask your physician about specific medications to avoid. As with all surgery requiring a general anesthetic, please do not eat or drink anything after midnight the night before your procedure, and you should arrange for transportation after the procedure. Post-op and results. Patients usually remain in the hospital overnight after the procedure, so your doctor can make sure you're able to empty your bladder. When you wake up after the procedure, you will have a small catheter in your urethra, which will be removed the morning after your surgery. After surgery, you will need to continue to use your regular method of incontinence control as the urethra needs approximately 6 weeks to heal. The sphincter will be inactivated during this time. The sphincter will be activated on your 6-week post-op visit. For patients with severe urinary incontinence or patients where other options for urinary control have been unsuccessful, an artificial urinary sphincter can result in marked improvement in urinary control and should be considered. Your urologist and clinical staff will answer any of your questions and provide additional information to help you decide if this procedure is appropriate for you. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure.